Let's do a quick cuff assessment in mechanically ventilated patients. Well, all you need is a white card for that. Well, in patient who is conscious, disconnect the ET tube from the mechanical ventilator and place this white card 2 cm apart from the ET tube, just like shown here in this patient. Now ask the patient to cuff on the white card. If you see the droplets are coming on the white card, that means the test is positive and the patient has good cuff strength. Well, the white card test method may not be as reliable as the peak cuff flow, but if you do not have access to the flow meter, then you can definitely use the white card test, as according to this study, the white card test has high correlation with the strength of the cuff in mechanically ventilated patients. To know more about cuff assessment and how to manage the load of the secretion in patients who have weak cuff, read the caption and follow cardiopulmonary rehab for more such videos.